Hi, I'm Lydia with Revelation Real Estate, and today in Solving Life's Next Chapter, we have two very special people, and we're going to be talking about COVID and the newest information that we have about COVID, how to protect ourselves, what to do with our loved ones if they are in a community such as an independent, assisted, or memory care. But before we get started, let's hear a word from our sponsors.
Grandpa, when you get out better, can we go fishing?
How about next weekend?
Really? Grandma told Mommy that you were really sick.
I was, but thanks to Mommy and Dispatch Health, I'm good as new.
What's Dispatch Health, Grandpa?
Remember when you broke your leg and Mom and Dad took you to the hospital?
Yeah?
That whole building, with the equipment they need, turns into a car with medical people inside, and they come to your home.
What did Mommy do?
She put this app on my phone. I tapped the app, and Dispatch Health made a house call. I never left the house.
Quality in-home medical care is at your fingertips, and it starts by downloading the free Dispatch Health app. Learn more by visiting dispatchhealth.com, and we'll send the mobile app directly to you, just like the healthcare we provide.
You know, Grandpa, I want to be a Dispatch Health person when I grow up.
Dispatch Health accepts Medicare and most insurance. dispatchhealth.com.
Okay, so we're back and we have Bernie with Vikor Scientific. Is that correct?
That is correct.
Okay, and we also have Andi with Nod Specialist, correct? Did I say that right? Okay. And Bernie, tell us what exactly is your company and what do they do?
Okay, so Vikor Scientific, we are a PCR technology laboratory, so molecular science. We specialize in infectious disease detection, excuse me, of UTI, gastro, respiratory, vaginal, wound, and nail, all through molecular science. So we're not a culture and sensitivity lab. We're not trying to grow anything. We are actually extracting DNA and RNA from simple non-invasive swabs to figure out what the pathogen load of each one of those swabs is, of every one of those infectious diseases that we're looking for. We have a huge panel, 150 plus pathogens that we are currently, let's call them bugs, that we are searching for. And the unique thing about our laboratory is we run each one of those pathogens found against 49 antibiotic resistance genes, so that the providers out there aren't simply doling out broad spectrum antibiotics that aren't needed or will not work with that particular patient. So that's where we shine.
Okay, great. Okay, and Andi, what does your company do? Give us a little bit of background on that as well.
Yeah, so at Nod Specialist, we're a telemedicine board certified infectious disease practice. So it's quite timely with everything going on, but we've been doing this for some time within the last couple of years, the telemedicine and practicing over 40 years. So really be able to have someone that is a specialist and an expert within infections is really important. So we have a platform. It's quite easy to use. I could say if you can get on Facebook, you can get on our platform. So we really make it user-friendly for all users. And then additionally, we offer infection prevention services. So really working with communities, working with hospital centers, clinics, maybe small group homes, to know what they should be doing to take care of their clients, their employees, and that there's whole safety kind of widespread throughout those communities.
Gotcha. Okay. So you both are like smack in the middle of this COVID-19 situation, and there's a lot of misinformation and or not even necessarily misinformation, just that the information that we started out with maybe a month or two ago has changed to today. That's a fair statement to make in the medical community? Is that correct?
Changing by
Correct.
the hour.
Changing by the, you sound like my daughter. So I have a daughter that's a registered nurse in ICUs, and I get a lot of updates from her, and it's a little different than what I'm hearing on the news. I totally don't watch or listen to any of the news anymore. I haven't for years. But I think it's really important for people to know that to get the right information, they need to really talk to somebody within the community or within the medical community about this particular virus. So tell us a little bit. The virus itself is more respiratory than anything else. Is that correct?
That is correct. That virus actually needs to be introduced to the body through a nasal cavity and then brought down into the lungs. So I was watching Dr. Oz the other day, and he said it so simply, and that is that the virus is like a key that needs a keyhole to go into, and that's the only way that it can enter the body and become that infectious disease that it's known as. It can't be ingested. You can't get it through a cut on your hand. It has to be ingested through the nasal cavities and thus introduced to the lungs.
Okay, interesting. Okay, so so what are you actually, Bernie, or is your company actually doing testing for COVID? And here's another question I have as well, because I work with a lot of folks that are in assisted living and memory care, and then, of course, I get information from the hospital, and I keep hearing that there's not enough testing kits out there. So our numbers are skewed, and the hospitals don't really know the exact amount of COVID positive patients that we have. So is that kind of accurate as far as that's concerned?
Yes, and so we are doing the testing. We do have the test kits available.
Okay.
We are limiting our testing to 65 plus of age,
Okay.
symptomatic, high-risk patients.
Mm-hmm.
And I truly believe that probably the lack of test kits nationwide is due to fear testing. You have a 30-year-old that's got a fever and a cough, and they go not waste a kit, but they use a kit that possibly could be used for this senior population, which we think is the most high-risk population in America.
Which makes sense. So the test itself, is it a swab? Is it a blood test? What exactly is the test?
So our test is a swab. It's a nasopharyngeal swab, so a nasal swab that goes deep into the nasal cavity. And that test is administered. The test is sent to our laboratory via FedEx Express overnight. Okay. And within 24 hours, we are having a positive or negative for the COVID-19. The unique approach that we took was we decided to not simply test for COVID-19. We have a full respiratory panel that we test for. Our respiratory panel currently tests, including the COVID-19 test, for 22 viruses, 15 bacteria, and 1 fungi. So it's a broad spectrum test that is not just giving us a positive, negative for the COVID. But it's also telling us what else is going on with that patient. Okay.
So, and why would you do that? Is that because there may be other symptoms that could look like a COVID virus, but could be something else? Or what would be the reason for testing all those other panels that you've got?
Sure. Super interesting fact is that we did a snapshot of all the respiratory tests that have come in since we started testing for CV-19, and 76.1% of those tests had co-infection, meaning they had another virus, they had another bacteria, and possibly a fungi. Some of them had up to 5 different co-infections on one patient. Wow. So, in layman's terms, you have somebody that has a fever, that has a cough, that has shortness of breath. If you were to take just a COVID-19 positive negative test and that test comes back negative, okay, what do we do? What do we do now as a provider? The patient is still symptomatic for some sort of thing going on with them. Also, what if it comes back positive, but yet you have 2 or 3 bacteria in high loads coming back? Neat thing about it is we can tell the providers that, and that bacteria can then be treated with an antibiotic regimen.
Gotcha. Okay, that makes sense. That makes sense. Now, Andi, you, I listened to you earlier today because I know you were on another panel that I was actually not part of, but I was listening in, and you actually work with a lot of our independent, assisted, and memory care communities because that's obviously a high-risk community or group, and with compromised immune systems. So what are you suggesting for someone who maybe has a senior, either they're living at home and or in a community? What's the best way to keep them safe? To if they end up with the virus, what's the best way to handle it? How are you doing this with some of these larger communities that you're dealing with?
Yeah, and I think that's a great question. It's multifaceted. Just to kind of speak to when you have a senior in the home, you obviously have a little less risk of transmission because you're not around other residents. You're not going to be having those other employees coming in and take care of them. But I think the biggest thing is just practicing those social distancing and washing your hands. Even though if you're cohorted with your family members, someone goes out to the store, they come back, they touch the doorknob, you just watch how that cycle goes. They go to wash their hands, but put the groceries on the counter, and then here comes that senior. I mean, we know the virus can live on surfaces for 3 days. So I think that's just the biggest thing. Is just making sure that hygiene is good. And then, additionally within independent livings and assisted livings, I would be asking and advocating for your loved one, just, what is your protocol? How are you taking care of my loved one? What are you doing for employees that have been exposed? What can we do to help? And so I think that all those questions are really good. And I know on the assisted living and the facilities side, they're trying to figure out all those steps too. But those are some of the questions I would just be asking as a loved one.
Right. And I do know both the hospital, my daughter has to go, everybody goes through now one door and they all get tested before they get into the hospital. And then we're housing a friend of my daughter who actually works at a memory care, and she's going to college, and she goes in every day, one particular entrance, and they do have a large questionnaire that they're giving her. Who have you been with? Do you have any of these different symptoms as you're going in? Has anybody that you've been around with have a low-grade fever, a cough? I mean, those are some of the things, like you just said, that they are trying to they're trying to keep that out of those places, because once one person has it, it sounds like it's pretty rampant and it's pretty aggressive and can kind of move from person to person pretty quickly if you're not careful.
Yes, correct. And I think what we've really been talking with facilities to have them be prepared. You have one person that gets it, you're behind the 8 ball, unfortunately. And so, just what you can do to make sure that those employees are following those things is just ever so important. And then one thing too, I was going to mention, one of the things that we're determining is that the loss of smell and taste is one of the first indicators. So keep that in mind.
That's interesting. Have you noticed that too, Bernie? Is that something that you guys have also come across as well?
Not personally. I mean, I've seen and obviously heard that also. That can be one of the symptoms, but we're we're a little past that. When we get involved, the
Right.
providers have already put a code out for a severe fever and or cough or shortness of breath. That's what they're going after.
Right. Right. Is it safe to say that if someone does end up having it, or if they feel like they potentially have it, my daughter has said there's things that people could do at home to kind of loosen up the chest, um, um, hold your breath for so much time, let it out, put your hands over your head, just to kind of loosen up that congestion before it gets to the point where it is a situation where you do have to end up in a hospital. Is that pretty accurate as well?
I know from my take, I'm sure Bernie, we both have stuff for that. Just from our take, I mean, there's a lot of things that you can do, but that's not going to protect you. And so,
Okay.
by holding your breath, that's making sure to know what's your capacity to keep your lungs going so that it doesn't turn into like a pneumonia or go deeper
Okay.
into an infection.
Right.
So I think that there's a lot of things out there. I'm not going to say that they're right or wrong.
Right.
It's just, is it going to protect you?
Right.
I know someone they're like, I'm going to drink lemon water and it pushes down into the gut. Hey, everybody's trying to find these things, right? What's going to
Right.
work, but it's not proven. So, I mean, positivity, to each their own, finding something, hands down.
And is it safe to say that the effects are different for every patient? Is that safe to say as well?
Well, we're seeing all over the media that there are carriers out there that are non-symptomatic, but yet can still have this COVID-19. So I think every body is different, reacts different. The immunocompromised patient or resident in an assisted living or memory care
Mhm.
obviously doesn't have that immune system to fight off
Right.
what's going on, especially if they've got multiple things going on, some
Right.
bacterial infection, another viral infection, and with the dormitory style lifestyle that they live, being in such close proximity of each other, it spreads like wildfire. And unless, like Andi said, there is a protocol in place, there's process and procedure to make sure that a patient that is or a resident that's potentially got this or anything else is quarantined, because it
Right.
spreads like wildfire.
Right, right. So a lot of people are now going out with masks on and things like that. Does that help when you're out in public, or is the social distancing really the best way to deal with this when you're out in public?
So it is recommended to keep the mask on, and just kind of, for example, if someone comes and sneezes and then that gets on the countertop and then someone comes to put their hand on there, right, that's the whole thing, and then they go to touch their nose. And so the
Right,
mask is really, helping with that transmission. But then two, if you're sneezing, you don't have your mask on and you're within 6 feet, that can jump right onto you. So
yeah, it can
practice
spread
both.
pretty. Exactly, exactly. So with allergy season right now, is that something, I mean, obviously, is sneezing isn't necessarily one of the symptoms, but if they do sneeze and they do have the positive, then that could be the cause of a spread, is what you're saying, basically.
Correct.
Correct.
Okay. Okay. So, so really, ideally for us, to wrap it up real quick, really the main thing is to help prevent the spread. And Andi, give us kind of like your last few minutes of your take on how to protect ourselves, how to prevent it, and what you want to tell our families, adult children, and their loved ones to help protect them.
Yeah. So here's one thing that I think is really interesting that kind of puts it in perspective. So there was a study that was done and it was monitoring how often individuals sitting at their desk touch their face. They touch their face 23 times an hour. So you start thinking about that, right? And so, hey, I'm going to challenge you all to be conscientious of that,
Yeah.
and just try to decrease that, and then to keep everybody safe, keep practicing that social distancing. I know it's hard. I know that there's long days. We're all in this, but this is really, really important because we're getting a lot of steps within the healthcare systems getting bottlenecked within the hospital system, and they are positive. Where do we send them? And that's really a whole other conversation. But just you are part of the solution by just social distancing. And then, for those individuals who have seniors, their loved ones, know that there's resources. Know that you can reach out. Like, we even have a triage line that you can call and just ask questions. And then
we can put that triage line on the bottom of our link too, if that's okay with you.
Yeah, absolutely.
Okay.
So I think just to know that there's resources, and don't be the first to go rush them to the ED. We can have this in a very timely manner. Let's really utilize that telemedicine, and then we can utilize Bernie's services to get them that testing that's appropriate. So I think just not being scared by telemedicine and embracing it.
Yeah. And then Bernie, what do you, I know your main company is the testing of it, but what are your advisors and doctors in your company? What are they saying as far as protecting loved ones as well?
Well, following obviously the CDC guidelines of social distancing, of hand washing, of using the available protective gear that is out there. I think the medical providers have to be really, really conscientious and careful, because they have the ability, if they don't practice the proper procedure of moving it from one community to another.
Right.
And they're all well trained, but I've seen cases early on where, when people didn't think this was what it was, there might have been a little lax procedure going on. And like I said, once it's in these communities, it spreads like wildfire. So
right. And I think you both had mentioned earlier before we started that you've got to be careful. I know a lot of people are wearing gloves, but then they're touching everything with their gloves. So really it's almost like it's spreading it almost even worse than
gloves are meant to be one and done. Put your gloves on. For instance, put your gloves on, go to the grocery store, do your shopping, touching that cart, touching those shelves, touching that ATM machine, whatever you're touching, and then as you leave, take those gloves off. If there's infection, it's on those gloves. Remove them properly, dispose of them, and put new gloves on for your next task.
Right. Okay. Well, I really appreciate you both coming on. And if you're okay, I'd love to maybe have you come on again, because I know we're not going to try to, it's not going to go away like tomorrow. Hopefully it'll go away sooner. And we can all kind of go back to some sort of a normal life. But I'd love to have you both back on so we can get maybe updates on what's going on with this situation and how the state of Arizona is handling it, and some of the hospitals and communities. And as you said, Bernie, earlier, it's changing sometimes hour by hour. So I'd love to have you both back on another time, and here maybe in the next week or two, and we can maybe go through some of the updates that you both have. And Bernie, for those folks that are watching, if they think that they need testing, is it best to go through someone like the emergency department, or is it better to go through like their primary care doctor?
That's an interesting question. I not only deal with a lot of assisted living, memory care, mobile providers who are in these communities, but I also deal with brick and mortar primary care physicians.
I figured you
did. They don't want sick people in their waiting rooms, so they are turning. From what I hear from patients, they're getting turned away when they go to their primary care, They're being told, go to the ER, go to an express med, and they're being turned away. So it's lack of testing. It's our lack of materials for testing. And then it's also, process, procedure, and policy of those individual places on what they will test and what they won't. Half the battle is insurance. Will commercial insurance reimburse these labs? We know firsthand that we're having a terrible time getting reimbursement from some commercial insurance. Medicare is not a problem with us. That's why we love catering to that senior population. Because A, we can service them, and B, we can make sure that we get compensated as a laboratory.
Gotcha. And I never even thought about that. So maybe next time we can dive into that a little bit more, because it sounds like some of the insurances aren't going to pay for some of these testings with this particular situation.
Absolutely.
Yeah. Well, thank you both for coming, and we'll have your information down on the bottom so that folks can reach out to you if they have any further questions. And we will have you back on Solving Life's Next Chapter. Thank you so much.
Thank you.
Thank you.